As Scotland emerges from lockdown, there are fears that a mental health crisis isn't just on the horizon, it's already with us.
For years I wore a mask. I was happy-go-lucky Emma. Nobody knew there was anything wrong with me.
Every day Emma climbs this hill to raise money for a mental health charity. During the pandemic, her depression became so severe that she tried to take her own life. She's been told it could be up to a year until she can see a psychologist.
I feel that if I didn't have such a good family and friends, that possibly, I might be at risk of, doing something to harming myself again. More money needs to be put into the NHS. It should have been put in a long, long time ago so that we can have more psychologists, more psychiatrists.
Steve wishes his son had felt able to talk.
He was about to graduate and all the prospects and everything else, and now you're just left thinking, well, what might have been, really.
Greg McHugh took his own life 5 years ago. He was 21.
We need to ensure that we're going to meet this kind of bow wave of young person's mental health crisis coming along. We need to have in the community counselling available, but also what you might call medical support triage centres, so that young people, they don't have to go on a waiting list to see the GP.
Jason is just a year older than Steve's son was when he died. After trying to take his own life last March, he's been helped by the Inverclyde Man On online group. Its membership spiked during lockdown, increasing tenfold.
I did get access to the therapy, but it was private, that we had to source ourselves. It wasn't like through NHS or anything like that. There should be more education for even doctors and things, but also education in schools to inform people about speaking out and things and dealing with emotions.
A year ago, Sarah McDougall left hospital after surviving coronavirus. The care home worker continues to suffer from long COVID and has been diagnosed with post-traumatic stress disorder. The counselling she accessed through her work is about to end.
We'll have to pay for private sessions because there's no support. It's just lacking support up here.
Sarah wants specialist counselling for those with long COVID.
Somebody to phone up and talk to when they're feeling low, when you're feeling angry. I don't ask for much. It's hard.
Psychiatrists Saman and Sadia work with children and teenagers. They've also launched their own YouTube channel to raise awareness of mental health issues among Scotland's Urdu-speaking communities. When it comes to young people's mental health, demand is overwhelming.
Before the pandemic, we had a waiting list for about 6 months, but now, after the pandemic, because of all these urgent referrals we've had, it's gone up to about 18 months.
It feels like on the ground we're firefighting all the time, really. Just because there's just been so much mental distress. We really need a lot more funding, and not just funding that's, short-term, temporary for the next year or so. We need sustainable funding.
Here are some of the main parties' pledges on mental health. The Conservatives say they'll increase the share of health funding on mental health to 10% by the end of the next Parliament and develop a self-harm prevention strategy. The SNP want to increase investment in mental health by at least 25% and ensure GP practices have a mental wellbeing worker. Labour want to set up mental health A&Es in every health board and develop a suicide prevention plan. The Liberal Democrats want to train more mental health specialists and double the number of people on counsellor courses. The Greens want to allocate 10% of frontline health spend to mental health by 2026 and increase access to therapy.